Hi, my name is Johanna Schouten. I'm a mental health coach and I specialize in perinatal mental health. Today, I wanted to talk about a certain subject. You know, in most cases, the love between a mother and a father and their baby, it's a very unique and basically unparalleled bond. So you can expect joy and tenderness. And again, in most cases, this overwhelming, all-encompassing desire to protect your wee one, to protect your baby. And I say in most cases because, you know, becoming a mum or a dad, becoming a parent is also a journey that for most of us, maybe it's fair here to say for all of us, for all parents, will at some point present its fair share of challenges. And I've not met many people that don't mind their relentless crying. Everyone needs sleep, and sleep deprivation that can push you, it can push even the most patient and loving parents to their limits. So there you already have conflicting emotions. There's love, there's also worry. There's wanting to nurture, but needing to sleep. And you adore your baby deeply, but you probably feel extremely overwhelmed, maybe frustrated, sometimes maybe even tempted to run away from it all when it gets too much. Understanding and managing these emotions, that's super important and something that I think is probably often underestimated when people decide to start to have a family. But it is a must to maintain your well-being during this period. You know, your mental health as well as your physical health needs to be taken care of. Also, being on the lookout for your own mental health and well-being is crucial in fostering a healthy parent-child relationship. And what's really silly here, silly probably isn't the right word, it's really important to keep in mind here, is that because you, as a new mum or a new dad, are experiencing such intensity of love for this wee miracle that you've produced, it's often very hard to look through that to keep yourself and your own well-being in mind. And we tend to forget or even dismiss the way that we're feeling because we go into this survival/love mode for our child, but we should really become a wee bit more selfish and take ourselves into account, you know, as it's vital in maintaining that intense bond with our children as we continue on that journey and to grow into a happy and healthy family together. And what I often hear and what I've experienced myself is that love that you're feeling towards your baby, that's sort of an indescribable force. It's something that nobody could have really prepared you for before or even during pregnancy. And often it catches new mums and dads off guard, and that in itself can cause feelings of being overwhelmed. And that overwhelming surge of affection and protectiveness that you may have been expecting to feel to a certain extent, that has gone to some next level of feelings. And again, it can catch you off guard. At the same time, you're also so busy being a parent that you may not take the time to really think about this and dismiss it as maybe baby blues and just sweep it under the carpet, to just get on with your feeding and napping and bathing and changing nappies and doing the housework, welcoming visitors. And at one point, maybe preparing to go back to your job, you know. And in the meantime, this foundation of your commitment as a parent, that's taking shape and it keeps you going. But these challenging moments may start to chip away in your mental well-being. And it is vital that you are on the lookout for this. Or if you can't see it for what it is yourself, it's really important to listen to people close to you that may want to advise you or even challenge you on this. And I'll give you a personal example. I didn't accept any help when my first baby was born because I was convinced, well, beforehand, I was convinced that I would be, that laid back, relaxed mum. And, I would maintain my wonderful social life even when my wee boy was born. But as soon as he arrived, and he arrived too early, prematurely, and then there were minor health issues, and I started to freak out and I started to push everyone away. And I wanted to control absolutely everything by myself, even my husband. And it took me It took me years to get past that, and it cost me about 90% of my social life, which went down the drain for many years. But I can honestly say that looking back on that period now, that I didn't see what self-destruction I was doing to myself, and as a secondary gain also to my family. Not a good secondary gain. And my relationships with my friends, my social life, are minimal. But it also harmed my relationship with my husband. I was challenged, but not to the extent that I felt I was being self-destructive. I was being challenged by him and by people around me, but I didn't feel that I was being self-destructive. I felt that I was being the best mom to my baby. So, what are they complaining about? What are they interfering with? And now in hindsight, I see what I did, but I also see what I could have, should have, and probably would have done differently if I'd known what I'd known before getting pregnant with him. And I cannot turn back the clock. I wasted precious time. I messed up precious time, which is one of the reasons that I've decided to get into this business of coaching parents, because time with your babies, time with your children, it's so precious. And because we get so stuck in the overwhelm, we forget about this. You never, ever, ever get that precious time back with your wee ones, ever. And, that thought alone, that motivated me every day to continue doing what I do now. We all have different challenges in life. We all have different challenges when it comes to parenting. And we all have different ways we react to these challenges and that we deal with them. We all have different feelings and worries about them. And basically, at the end of the day, we are all unique and we all experience similar situations in different ways. And I think for a big part, therein lies the problem, because we are not one size fits all, and the solutions aren't one size fits all. And I'll give you an example. The challenge of a baby constantly crying. We can't communicate with our wee ones at the same level we do to older kids or to adults. And I always say that instead of giving birth to that placenta, I would have liked to have given birth to an instruction manual, especially that first year. And in hindsight, I would even endure the pain for a manual for the first 18 years. And I'm not even that far in yet. So anyway, our babies, they do communicate with us, and they do it through, signals of pooping, peeing, drinking. And that more or less tells us all is well with their health. Because if they weren't doing that, then, that was a way of them communicating to us that there's something wrong. And at one point, they will start smiling and they'll start giggling and they'll start moving and they'll start wriggling when they interact with us, when we interact with them, which is, again, a means of communication for them. So I think you get what I mean. And they also communicate through crying. And especially in the early days after birth, they will cry and it can drive us to distraction, but we have no idea what's wrong. And that's very often when we're already exhausted that we start to also doubt everything that we do. And it's so important to remember that so long that they can't talk with words or through, more prominent body language, like the giggling or the purring, for example, up to that point, as their only way of expressing their needs and maybe their discomfort or even pain. And yes, I know that persistent crying can be mentally and emotionally, and at one point, probably even physically draining, due to everything going on in your life. It's a huge change when there's this other human being in your life that depends on you 100%. And that can be a really daunting thought. And now on top of it all, you're having difficulty to decipher what's wrong with them, why they keep crying. And that frustration and helplessness that arises from not being able to calm your baby, that can be so overwhelming and trigger a wide range of emotions with us. And each and every one, although a generic problem in parenthood, will attach our own emotions and our thoughts and feelings to it. And boy, you know, that can really mess with your mental well-being. That crying, it goes everywhere, even when the baby isn't even with you. And another, you know, generic, for lack of better words, struggle that we then have is sleep deprivation. And most parents will second this, and some to the extent that it makes them go slightly mad. I was there once, so I know what it's like. You know, babies have their own unique sleep patterns, and they're so hard to figure out. And once you do figure them out, then their whole schedule will change because of their developmental stages. You know, children go through developmental stages logically, and that messes with their feeding and their sleeping as well. Or maybe because of seasonal changes. You know, it's really quite warm here at the moment, and temperature changes. Babies don't sleep. My children are older now, and they don't sleep very well at night because it's so warm, and that can happen to a baby as well. You know, they again, they can't tell you that they're warm, they're too hot or maybe too cold, and these things can affect things as well. Or maybe they're going through a growth spurt, and that can change your sleeping patterns. Or you as a parent disrupt the pattern by keeping the babies. That's what I used to do, keeping the babies up longer. Or, you know, I used to keep my oldest one up during the day in the hope that he would sleep at night. Some parents take the babies into bed with them, or swaddling them, or not swaddling them, or, you know, the list goes on. And again, sleep deprivation is a generic problem for most parents, but it's also unique to each and every parent, how or why or when or how long for it happens, and what effect it has on their emotions. So the solution, again, it's also unique to each and every individual situation. Again, it's not one size fits all. What works for one may not work for the other. And what is pretty generic is that sleep deprivation and constant exhaustion and overwhelm, that can take a significant toll on your mental health and on your emotional well-being. And the chances of you becoming fatigued, and that affecting lots of other areas in your life, the chances of that happening are very, very big when it starts to snowball into all these negative emotions. And it will most likely intensify these, as I said, it will intensify these negative emotions and make it very challenging to cope with all the demands of your days now that you're taking care of not just yourself, but a whole family, let alone your social life and possibly also your work life. So I keep saying that every situation is unique. And when you suffer from any or maybe even all of the above, then the chances are really high that you go to your good old friend Google to start searching for solutions. And there are many solutions out there. Be prepared for many of them not to work, as again, they are also very generic. They may not fit your unique situation. So consider yourself lucky when you do find something that works. And consider the fact that whilst this may not work now, or maybe it does work now, maybe it doesn't last. Maybe it's not a lasting solution, you know, to do things like, I don't know, use a weighted blanket, or to go to do sleeping coaching for babies, or to journal everything, or to try different teats or dummies, try different milk formulas, try different foods. It may work for a little while, but things can return. And I know that doesn't sound very encouraging, and I don't mean to sound negative. I am, however, trying to be realistic. And I sincerely hope that you find something that works for you. But I just want to warn you that when these things start to eat away at your mental health, these solutions are basically like a plaster on an open wound. You know, that wound still needs to heal, even though the plaster is soaking up some of the blood. It's just a temporary thing. So that's basically a metaphor for temporary relief, that you found a solution. And that may sound like you want it, probably sound like all of your problems are now solved. For example, you've searched for months for that formula for your baby, and that doesn't make their tummies hurt. and you finally found something that works. That's great. I was there at one point. I even tried goat milk formula at one point. And I really mean that. It's great when you find something that does. The goat milk didn't work, but it's really great for you that you found something that does work. But there's nothing worse than seeing your wee one in pain and then, finding anything that gives them the relief. So that's great. But beware, you may have found your solution, that plaster on that open wound, and that plaster is the formula that helps your baby's bowels and tummy hurt less. But what has been happening in the background to your mental health fitness? That's a genuine question, and it's a very important one to keep asking yourself. That relief, that temporary relief, it may last for many years, I hope so, but it may also be just a breather before the anxiety and the stress and the overwhelm, maybe OCD, etc. They may hit you, and it's going to hit you twice as hard because you probably don't see it coming. You had a solution to the problem, right? So why aren't you feeling it? Well, basically, that plaster isn't healing the wound. It still needs time to heal, and you may be putting extra pressure on that wound because you had expected all your worries and struggles to now melt away like snow in the sun, and it's not happening. And the best advice that I can give you here is to not ignore this. Don't sit around and wait for better times to come around. Seek support, seek help, talk to people about it, and don't hold back. Tell them everything, even though the stories probably aren't pretty and nice and not the romantic way that you would hope to be as a mum or a dad. Reach out to your partner, reach out to family or friends for support. They may not completely understand it, but they can help you make sense of it or help you seek help. If you keep quiet, then you'll be staying up here. You'll be staying in your own headspace. And that's just not the best place, not the healthiest place for you to be at this point in time. It may make, the thoughts and the feelings that you're having, it may make them worse because you're more or less internalizing them. So having someone to share the load with, having someone there who can give you a break from being in your own head all the time, or even someone who is going to help you try and make sense of all that stuff swirling around in your head, that can maybe give you some clarity. And even if it's clarity that you need to seek some professional help because you can't figure it out within your own trusted circle, then that in itself is a huge, huge step for you and your mental health in the right direction. And there's another thing that I wanted to advise really every struggling parent is to really prioritize self-care. And I know I've said this before in another video, I think maybe even more than one. And I'll use a metaphor because I worked in aviation. On a plane, when they do the flight safety demonstration, you're instructed to put on your own mask first before attempting to help others. So take care of you, because if you don't do it, nobody else can get to you to help you properly. And I know, because I've been there, I felt really selfish, and you may feel selfish also, or you may feel guilt that you're not spending that time with your child. They will survive. Better a mum that is there for 1 hour a day for a week than a mum who looks back after their 18th birthday when they've moved out and thinking that they should have prioritized themselves at the time, and they would have been much happier and healthier, and they would have happier memories with their kids to look back on. No regrets of what could have been. And I can give you loads of tips on how to take care of yourself, like taking naps while your baby's down, anywhere where possible, basically, instead of doing the housework, or, giving up your job maybe to become a stay-at-home mom, or maybe for your sanity to get a job so you don't have to be a stay-at-home mom. Nourish your body with healthy food, go outside for walks, engage in relaxation techniques if that works for you, or mindfulness or yoga, or try journaling, meditating. Believe me, I've tried and tested many of these things. And many of them sound really wonderful on paper when you read about them online while searching for those tools to help you out. But again, that's not one size fits all. What relaxes you may not relax me or the next person, and now you're putting pressure on yourself to do something and to feel something that may not be the right fit for you. Maybe you're feeling like getting a haircut and that does it for you. Great. If it's sitting down, designing your next tattoo and going to the tattoo parlor to get it done, that gives you energy. Great. That's just something that's over my mind. But if it means maybe going on a mini break to a spa, or maybe for somebody else, it's a mini break to go bungee jumping, then brilliant. It's not one size fits all. Do what feels good for you. And if you can't figure out what relaxes you, I was there once. I found it really hard to find out what relaxed me. Then again, go and talk to people, read things online, try things, and don't feel like a failure if they don't work, but just keep on trying. You are a unique individual, and what works for you, what fits you, is different from person to person, and that's fine. But what's not fine, what's not okay, is that because all other mums swear by one thing, that you need to do it too. It just doesn't work that way. It's not generic there. It may be exactly the opposite of helping you relax. And then if you find it hard to find something, or when you find it hard to challenge yourself on this, maybe you can turn it around on yourself. If you saw that your best friend was struggling, what would you advise them to do? What would you advise him or her to do? Go on, even though it's clearly making things worse for you, or go and look for something that is a good match and will help you. You as a unique individual will help you in the long run. And truth be told, that long run may require some professional help. There's no shame in that. And again, there's a lot of choice out there. What fits you may not fit somebody else. And I offer help to many men and women that struggle to cope. I have a wonderful way of helping, and it's also a very quick way, which is exactly what I was looking for when I was struggling with all my postpartum mental health issues. And believe me, it took me years and years, and my postpartum mental health issues declined into full-blown anxiety disorder. And that was years after that I finally worked out what was really going on with me. But when I did figure it out and I more or less resolved it, it did motivate me to, really dig into it and to learn for myself a skill set that I now have and I'm really happy about and I'm really proud of, to be able to help people get back on their feet long term in the shortest amount of time, which I find really important because time is just so important. You don't want to waste time when it comes to your kids. And if I had only known about this many years ago, I would have been able to enjoy motherhood a lot more with my kids. And that's a horrible thing to have to confess, but it's true. There were many, many years that I was not the best mum to my beautiful 3 children. But now it does motivate me each and every day to assist as many people struggling from similar issues, as many people as I can, to get them back on track. And having said that, as much as I, of course, want to promote what I do, because it is really quick and extremely effective for the long run, I also realize that one size fits all doesn't apply to my coaching either. So I welcome anyone to come and try, obviously, as I really do look at people without the one size fits all glasses on, which I think a lot of therapies do. Everybody's unique. I've said this a couple of times before, and I really tailor to your individual unique needs. Having said that, I also really truly get that it may not be for you to work with someone who does online coaching, or you'd rather try things like meditation, maybe dietary changes or medication, psychological help. I understand that you, again, here you are unique, and I hope and pray for you that you find your way that will help you. Some people see for example, medication as the quickest solution. And if that works for you, I can only encourage you to do your own digging, to do your own investigating and follow your journey. As long as you don't do it on your own, you really need help for this. And I think that's sort of the message I'm trying to bring across. Get help. What I'm trying to say is that reaching out for help, whoever with, that is most likely the very best starting point and will increase your chances hugely to get your mental health back on a healthy track. Becoming a mom, becoming a dad, becoming a parent is wonderful. It's beautiful. I would not have wanted to miss a single moment of it. Some things I would have loved to have done differently, but I wouldn't have wanted to miss any of it. But it's also extremely difficult at times. And if you feel like you're surviving instead of thriving, and again, I've been there, done it. If you feel that you're surviving and you're not thriving, then it's really time to get some help from outside of your own head. And every parent deserves to love and enjoy their life as a mom or dad. And every child deserves a parent that feels up to the job and help them become their best self without losing themselves as a parent. And I often hear people being given the advice that, all the exhaustion, all the crying, it's all temporary. It's only a phase. It's only the first year that's really hard. What if that phase continues on for longer than you had expected? And you, like me, regret that you didn't reach out sooner. And now you can never, ever get that time back with your wee one. Keeping this perspective in mind, that will hopefully motivate you to take a very careful look at yourself and really consider reaching out to someone other than you've done so far to really help you along in this beautiful and incredibly challenging journey of motherhood or parenthood. Every parent on this journey will find moments of overwhelm, probably frustration, maybe anxiety, exhaustion, etc. The list goes on. It's a fairly normal response to an intense situation, but acknowledging and managing these complex emotions, that is crucial for maintaining your mental well-being. Please reach out if you feel that I can help you. Take care.